Welcome to PEDS Developmental Milestones. The PEDS-DM is a screening and milestone surveillance measure for children from birth to age 8. It is published in English and Spanish. Here's how it works. This is the notebook that houses the PEDS-DM. Needed materials are inside, including brief directions, a manual with photocopiable parent education handouts and referral letter templates, the family book with the PEDS-DM questions, a dry erase marker and a clip to secure the correct page. To begin, retrieve the family book and the dry erase marker. Each page is laminated and parents are asked to mark the answers to the 6 to 8 multiple choice questions per visit with a dry erase marker. Just inside the family book and notebook, you will find a quick guide on how to select the correct form for the child's age. Ages are not written on the form so as not to distress parents of children with significant delays. Instead, forms have a letter name and the quick guide identifies the age range by letter name. In this case, we are working with a family of a 4-month-old. Place the clip on the correct page and give the family book and marker to the parent. If staff are too busy to facilitate completion in the waiting room, parents can be asked to complete the questions once they are ushered to the exam room. The PEDS-DM can also be administered by interview with a provider directly eliciting skills from children when indicated. It will take less than 5 minutes to answer the PEDS-DM questions. When answers are completed, pull out the purple scoring overlay. Align registration marks. The overlay shows the areas of development each question measures: fine motor, gross motor, expressive language, receptive language, self-help, social-emotional, and for older children, reading and math. If any answers show through the scoring template, they reveal less than optimal performance in that developmental area, below the 16th percentile. Scoring below the 16th percentile is fine for height, weight, and head circumference, but when it comes to development and future school success, the 16th percentile is a huge problem. Intervention is needed. Transfer incorrect answers to the recording form as a horizontal line through the box. Transfer correct answers to the recording form by filling in the entire box. Over time, the recording form builds a growth chart of developmental strengths and weaknesses. Attach the completed recording form to the child's chart and wipe off family answers in readiness for the next patient. When referrals are indicated, you can use the referral letter template in the professional's manual. The manual also has information about how to find services. These documents are also downloadable, as are parent education handouts from www.pedstest.com. Please note that the PEDS-DM has lots of developmental promotion activities built in. For example, once families have answered the questions, they are asked to read a short story to their children. This helps promote development and positive parenting practices. In the case of a 4-month-old, parents read about the joys of imitating their baby's sounds and how babies learn to happily reciprocate. Other stories deal with the issues of older children, such as managing tantrums, shopping challenges, healthy snacking, and dealing with sibling rivalry. The PEDS-DM manual houses much in the way of parenting information that you can photocopy. These are also included on the website in both English and Spanish so that you can download and customize them. Included are parenting handouts for promoting language, managing behavior, and encouraging motor and social skills. Links to referral resources are also provided. Another feature of the PEDS-DM is that the second section of the family book contains a variety of short measures useful for complying with the 2006 American Academy of Pediatrics policy on screening and surveillance. For example, the modified checklist of autism in toddlers is included so that at 18-month and 24 or 30-month visits, you can easily comply with the AAP recommendations for autism-specific screening. The AAP also recommends that you screen for psychosocial risk factors, for which twice during the first 2 years of life is recommended. To help you, the PEDS-DM includes the Family Psychosocial Screen, which has a 3-item parental depression screen. The Family Psychosocial Screen also addresses issues such as social support, domestic violence, history of abuse as a child, parental substance abuse, parents' level of education, family medical history, smoking in the home, and gun storage, etc. Many clinics use the family psychosocial screen as a new patient intake form. Next up is the Brigance Parent-Child Interaction Scale, which measures resilience and risk for developmental problems, such as whether parents are reading to their children, talking with them, and enjoying their child. There are also 2 screens for older children. One is the Pictorial Pediatric Symptom Checklist in its 17-item version, which has 3 factors. These allow screening for depression, conduct problems, and attention difficulties. The second screen for older children is the Safety Word Inventory and Literacy Screener, also known as the SWILS. It screens for academic difficulties, especially reading. Last is the Vanderbilt ADHD Diagnostic Rating Scale. While this measure is not a screen, it is useful to use when a child has elevated attention factor scores on the PSC. The PEDS-DM manual contains the scoring for all the optional measures. Finally, the PEDS-DM also comes in an assessment version, which is ideal if you are working with a high-risk population, such as children followed by the neonatal intensive care units, early intervention, foster care, or WIC programs. The PEDS-DM assessment level enables you to administer more items at each age level, and it provides age-equivalent scores in each domain. You can also determine percentage of delay and, perhaps more positively, percentage of skills mastered, including performance that is above average. The assessment booklets are designed to be reused with the same child over time. In this case example, a child with motor coordination problems was tested at 3 years 2 months and had notable weaknesses in many domains, most especially fine motor, self-help, gross motor, and socio-emotional skills, also called getting along with others. With intervention and on repeat testing 14 months later, this child is clearly doing better in all areas, even while there are clearly continuing needs. Our website, www.pedstest.com, has an extensive list of frequently asked questions about billing and coding for optimal reimbursement, finding referral resources, test administration, research findings, training advice including slideshows, and ordering information. The PEDS-DM manual also includes research on the psychometry supporting this measure. We also encourage PEDS-DM users to join the early detection discussion list hosted on pedstest.com and share your experiences with us and other professionals, including many other screening test authors.